Assalamu alaikum. Welcome to the second podcast of Wellness Ka Safar. Today, we're having a conversation with Dr. Murad Moosa Khan. Um, Dr. Murad is an MBBS from Dow University of Health Sciences, an MRCP in psychiatry from Royal College of Psychiatrists, UK, a PhD in psychiatric epidemiology from University of London. He is the lead scientist at Brain and Mind Institute at Aga Khan University, the professor emeritus, Department of Psychiatry at Aga Khan University, a program lead at International Association of Suicide Prevention. In fact, in 2017, he was the first Pakistani and first Asian to be president of International Association of Suicide Prevention. Dr. Murad is also the associate faculty at Center for Bioethics at SIUT. His research interests, some of his research interests have included suicide and attempted suicide, mental health of women, and ethics and medical practice. We are really honored that he has agreed to be a part of our podcast, and I look forward to my conversation with him. Thank you. Okay, Assalamu alaikum, Dr. Murad.
Assalamualaikum.
How are you?
I'm fine.
Thank you for taking out this time and
My
speaking to
pleasure.
us. This is our second podcast on Wellness Ka Safar. We're basically trying to build a community and create more awareness around mental health. And so we are doing different podcasts, we're doing different trainings and workshops for the mental health community. We had our first interview with Dr. Rubina Kidbai, and we're happy to have our second one with you.
Happy to be here.
Okay. So, I've been reading up on your research and things, and there's a lot of research that you've done on suicide and self-harm, and for decades. I wanted to ask you, how did you get into this particular subject?
uh, I always tell this story because I've been asked this question many times. Uh, there are two parts to this. One is that when I came back to Pakistan in the early 90s, looking for and joined Aga Khan University, one of the major requirements of a faculty member at AKU was to do research because it's a primarily an academic institution. And academia really means generating new knowledge, and you can only do that through research. So I was looking at various areas, and of course, research in mental health in
Mm.
Pakistan was, by the way, should we be speaking English or Urdu, or both?
We can do both, whatever you're
Okay.
comfortable with.
Okay, so I'm comfortable with both.
Mm.
So research was a big issue, and I was looking at various areas to research, and this was before the computer and search engines. So I was going through the library, looking at various journals, and I came across an article on attempted suicide in Saudi Arabia. It was done at Aramco, which was the American Arab oil
Mm.
company. So someone had published, employees में कितना था उसका. And that's something, it triggered something in me कि अगर एक company in Saudi Arabia का ये लिखा है तो I don't know पाकिस्तान में क्या इसकी situation है. Of course, I was seeing patients in clinics uh, who had attempted suicide or were feeling suicidal. So that kind of triggered something on me. But going back further,
Mm.
uh, I came across a quotation by John Donne, who was a metaphysical poet, I think 17th century metaphysical poet and a philosopher, a theologian. And there's this very famous quotation by him from a verse: any man's death diminishes me because I am involved in mankind.
Mm.
Uh, And the full verse is, and therefore never sent to know for whom the bell tolls, it tolls for
Mm.
thee.
Yeah.
Which really means that,
Mm.
if anyone dies, then a part of you dies because we are
Mm.
part of the same common shared humanity.
Mm.
And that was a quotation. I don't know. I was probably in about eighth, ninth class में होगा शायद.
Mm.
वो, it stuck with me. I'm
Mm.
fond of quotations, but that somehow stuck with me. And I really, when I look back, every time someone asks me this question,
Mm.
I try and link these two things, coming across an article by chance, then something
Mm.
triggering in me, and then going back to this quotation. And in psychiatry, we are not dealing with life and death as people do in other branches of medicine, like surgery, for example, critical care, ICU,
Yeah.
physicians, and so on. But suicide is one mysterious um, area, act, behavior that psychiatrists or other mental health professionals are faced with. So that really was the start. And obviously, in research, you come across something, you take the lead, you look for follow that lead, and before you know it, 10 other questions start coming out from that. So
Mm.
that triggered something. I said, let me look what is happening at AQ. Are we getting cases or not? AQ had invested very early on in a very, very good health information system.
Okay.
And so it was easy for me to look at the records of people who were admitted to AQ or who
Mm.
came to AQ after Self-Harm Act.
Mm.
So that was really the start
Mm.
of
Okay.
and then, you know, falling from self-harm, looking at suicide, digging in more and more deeply.
Mm.
ये भी मैं बता दूं आपको कि उस इनिशियल स्टेज पे uh, I searched, got the help of the library and everything. I
Mm.
only came across two studies on suicide and self harm in Pakistan.
Mm.
One was published in 1981 by Professor Haroon,
Mm-hmm.
uh, the late Professor Haroon.
Yes. Mm.
And it was a very small study, 3 pages ki three, Journal of
Mm.
Pakistan Medical Association mein. And in that study, he had quoted another study, which was
Mm.
published in 1963.
Mm.
And I've never been able to get hold of that original
Mm.
study, but uske andar unhone references ka diya tha.
Mm.
These were the only two studies on which I had something to go on.
Mm.
और रिसर्च में बड़ा important होता है कि you review what has been done previously. What are the findings? What are the
Mm.
gaps? And what new
Mm.
evidence you want to build? So starting with almost a blank slate,
Mm.
completely blank, and then building from there was exciting but very, very challenging.
Mm.
And I kept searching and searching कि कैसे हो सकता है. Here I am in the mid 90s, or Pakistan came into being in 47, almost 50 years. How can it be that there have been
Mm.
no studies? No one no one ever been interested in this?
Mm.
And it was true, no one was interested. But suicide was happening, self harm was happening in Pakistan. So that's how it started. Now in 2025, if any person wants to study suicide, they will have a huge amount of information from various parts of the country on which to build on.
Mm.
So that is very important for a young researcher
Mm.
coming into the field wanting to research this. They will have something to
Yeah.
to go on, and then obviously come up with new ideas. So that is
Thank
how it
you.
started.
Thank you for sharing that. A lot of your research talks about systemic issues, चाहे वो गुर्बत हो या other factors. Um, what have been your learnings, major learnings from this over the years?
So, while the most important learning has been that you cannot see a problem in isolation. So,
Mm.
mental health की जब हम बात करते हैं, so it is not just looking at one's mental health and what can be done about that. Really, be a part of the mental health is part of the larger socio-political, socio-cultural,
Mm.
socio-religious context. And that's where we falter as a society. We have not evolved, we have not progressed, we have not laid the groundwork, the foundations on which to build a strong environment. We don't have that. And that is why we are struggling even now. So these are structural, systemic issues. Without really addressing them, tinkering with mental health, coming up with
Mm,
solutions, whether there are new solutions using AI, it's not going to work.
mm,
It will
yeah.
not work because the systemic problems, are there. It's like, what you see in Pakistan, what you see in the streets of Karachi. We have these
Mm,
four-wheel drives. We have the
mm,
latest models of cars,
mm,
luxury cars, but we don't have a good road system or a
yeah.
traffic management
We
system,
don't
which
have
is
the
the foundation.
yeah. So we
We
don't have the
just don't have that.
infrastructure for it, right?
Yeah.
Um, have you over the years seen any improvement?
A little bit here and
Mm,
there, but it is not organized. It is not done systematically. It is not evidence based. And again, main issue is the political will, a
mm,
deep desire to help other people, to ease the suffering, to ease the distress. Looking at what are the fundamental things,
mm,
whether it is supplying clean drinking water,
yeah.
or looking at the law and order situation, or health and education. So one, we have to have this deep desire to help other people,
Mm,
ease the suffering, and take away their distress. What is causing the distress? Looking really at the fundamental issues, and I don't see that happening.
yeah.
And part of the reason is because a governance system is so bad.
Mm,
The foundation on which Pakistan has had been built and what it was supposed to progress on has been decimated and
mm,
eaten away completely. And today in 2025, you can see what is happening in the country.
yeah. There's this new sort of report that I read yesterday. It's done by an organization called Milkar. They're doing social media awareness about mental health with the support of British Asian Trust. And they talk about 1 in 4 Pakistanis will have a mental health concern. That's the size of a country. And it sort of baffles me as to how we are going to manage this crisis. The numbers just seem so huge, and one psychiatrist for approximately 300,000 people. It kind of really doesn't make sense.
No, it doesn't make sense. Having said that, we really ought to be careful in quoting these kind of figures.
Mm-hmm.
There is a difference between mental health problems and mental distress.
Mm,
And the vast majority of Pakistani population is suffering from mental distress.
mm. Okay.
And these are due to the adverse social circumstances, which are now called the social determinants of health and mental health. Some of them, obviously, depending on individual circumstances, then go on to develop mental health
Mm,
disorders.
okay.
But it's the larger component of mental distress,
Mm,
parishani,
mm,
which is the mental health crisis. But the mental health crisis in Pakistan is man-made. Remember that it's completely man-made, which means that if we were to look at some of the factors, we can change them. So it's not like a natural catastrophe that
okay.
earthquake को आप prevent नहीं कर
Mm,
सकते हैं. आप सिर्फ अपने घर को earthquake resilient या earthquake resistant बना सकते हैं. Mental health crisis in Pakistan is man-made
mm,
by our policies, by our approach, by the things that we do and that we don't do.
mm,
So जितनी भी campaigns हैं of how to
mm,
raise awareness about mental health and
mm,
so on and so forth, these do not look at the fundamental reasons what is driving the mental health crisis in Pakistan,
mm. Which is
and they never
mm,
which and that they don't want to address because that's a
mm,
much more difficult thing. How do you challenge power? How do you speak truth to power? How do you hold them accountable?
mm,
तो मिनिस्टर के साथ फोटो खिंचवाना इज वेरी गुड कि आपने ये कर दिया और
mm,
मिनिस्टर ने हेल्प कर दिया बट मिनिस्टर ही की पॉलिसीज हैं जो आपकी
mm,
मेंटल हेल्थ क्राइसिस को
mm.
ड्राइव कर रही हैं.
So
So
it's really about fixing the system and fixing the infrastructure, and fixing the basic needs of the people.
yep, absolutely.
It's like Maslow's hierarchy of needs. If your first need is not fulfilled, how are you even going to go up?
Absolutely, I totally
Mm,
agree. So it's no use raising awareness. I mean, what do you do when you raise awareness about, say, a woman in Liari,
mm,
low socioeconomic class, who's got 7 or 8 children, undernourished, husband unemployed, maybe using drugs. She's a victim of domestic abuse. You go and do a PHQ-9 on her,
mm,
uh, or a GAT-7, which is for anxiety and depression, और वो स्कोर कर देती है हाई,
mm,
और उसको बता दें भाई आपको तो डिप्रेशन और एंजाइटी है. What do you do with that? So
yeah,
raising awareness, telling the masses that you're suffering
mm,
from mental health problems
mm,
and not providing them either the means to seek help, or or looking at what is causing them to become mentally unhealthy or distressed, or
mm.
that, I think, is a great disservice that we do.
And this mental distress then just snowballs into not only mental health, but physical health symptoms that come up for so many of these individuals, right?
Yeah, absolutely.
Hmm.
Yeah.
And so it sounds like it just compounds into so many different problems.
Yep.
Yeah. Mm,
Absolutely. So, it affects all your behaviors. Mental distress may lead
mm,
to health problems. Health problems will lead to low productivity. Low productivity will lead to socioeconomic issues. That may lead to antisocial behaviors. If a person cannot eat, cannot feed his children,
mm,
and they have no means to do so, then what
mm,
do? You resort to maybe stealing, or robbing others, or doing all sorts of other things.
mm,
Some people may fall into substance abuse as a form of relief. Violence is another form of that.
yeah.
So, certainly there is a mental health crisis, but it's much more than just a mental health
Yeah.
crisis.
Yeah. Yeah.
It's a crisis of governance. It's a crisis of integrity. It is a crisis
Mm,
of ethics,
mm,
and I think it's important to expand that and not
mm.
just focus on mental health crisis. Because as
Yeah.
soon as you have mental health crisis, you look at how many psychiatrists are there, how
Mm,
many psychologists are there, what can
mm,
be done, what are the services. It's a very reductionist
yeah.
approach. It's not a mental health crisis. It's a crisis of governance in the country.
Absolutely. Okay. Thank you. Thank you for that insight. You also wanted to touch upon women and mental health. Um, would you like to say more about that?
So, all the research that we have done and all the research that has come through from Pakistan, uh, very interestingly, highlights a number of salient points. One is that all the surveys show that women have higher rates of depression and anxiety, which is the most common mental health problem,
Mm,
than men. So that's number one. And that is not very different from what we find worldwide. Women suffer from mental health issues much more than men. All surveys actually show that. In suicide and attempted suicide, we find the same, that in attempted suicide, more women feature than men. In completed suicide, people who actually die by
mm,
suicide, there are more men than
mm,
women, but the ratio is narrower. So global जो rates हैं, global जो ratio है, it is 3 men to 1 woman who die by suicide.
yeah.
In Pakistan and many other low middle income countries like Bangladesh, for example,
Mm,
India, China, and several other countries, the ratio of men and women is much narrower. It's 1 to 1.
mm,
And in some places like Bangladesh, it is actually reversed. There are more women than men who kill themselves. And when you go to specific areas like, say, the rural areas, you will find that even in Pakistan. So that's number one.
mm,
Suicide is the is the kind of the extreme end of the mental problem. So it's a very extreme act that people do give up. So that's number one. Number two, what we have found is if you just look at women's statistics, then young married women feature much more than young single women.
Okay.
And which tells you, and that led to us to look at what
Mm,
is happening there, and what is the concept of marriage and how does it play out in the
mm,
Pakistani society and how does it affect men and women. And this is what we found. All our studies from suicide show that if you look at women's statistics, there are more young married women. So when I say young married women, is between the ages of say 17, 18 till the age of 30, 35.
okay.
After that, the difference between men and women kind of
Mm,
starts to equalize.
mm,
So young married women, followed by young single women, followed by young single men, and then followed by married men who have the lowest rates.
okay.
So marriage in Pakistani society affects women and men very differently. And we looked at some of the factors that was driving this. We found that it was early age of marriage,
Mm,
the concept of this arranged marriage, particularly as you go now the socioeconomic class. Then there was the issue of um, joint family systems, living with the
mm,
in-laws. Then there was the issue of economic dependence on the husband,
mm,
so women not having independent means of sustenance,
yeah.
of income. Then it was in many cases women giving up their education and getting married. So, 18 you would be in doing your inter or graduation, uh, and the average age of marriage in Pakistan, the mean age of marriage in Pakistan is about 20 years.
Mm,
So you have young women getting married and then curtailing their education, which obviously education opens many more doors to employment and so on. Then pressure to have children early on in the
mm,
marriage. Then pressure to have produce a male offspring.
mm,
And then this huge epidemic of domestic violence,
yeah.
verbal,
Mm,
economic,
mm,
financial, sexual,
yeah.
physical violence. The threat
Absolutely.
of divorce,
Mm,
um, threat of second marriage
mm,
in cases of either infertility or any other issue. So all of these things are playing out in women that then gets translated into compromised mental health, and some of them then gets into converted into suicidal behavior
mm,
as all the doors for the woman is completely closed. And when I say women, really, you really have to look at the whole spectrum of women in Pakistan.
mm,
Rural areas, women who are totally illiterate, um, to the middle class, to the more urbanized. So you really have to look at the whole spectrum and not focus just on one strata of the
mm.
society.
So do you feel that this represents all socioeconomic stratas that you've researched?
Yes, but of
Okay.
course, findings in different social strata would be much different. Women who are educated in the upper social strata are much more empowered. They have
Mm,
the means. They have the knowledge. Their families may not be that restrictive in terms of closing the doors on them completely.
mm,
So ये सारी चीजें play out करती हैं. So obviously, depend. So when I say this is general,
mm,
even in the higher socioeconomic strata, women who have been educated abroad, are very well off. They still have the same kind of
yeah,
pressures on them. Obviously, they have also
mm,
ways to deal with that pressure, but
yeah.
as opposed to women coming from the lower socioeconomic strata.
So, I mean, not only what you're saying is not only our basic needs kind of not provided for the a large majority of the population, but with women there is an added effect of early marriage, domestic violence, lack of sort of choice, and also unable to get out of the situation that they're in. So
Absolutely.
that just adds on to the mental distress and everything else that that woman goes through.
Bilkul.
Yeah, yeah, okay. Um, so it sounds like a really bleak sort of picture, but have there been um, has there been progress? Has there been something that you would say, okay, yeah, here's a glimmer?
Obviously, there has been. I mean, women education, for example, is much more. If you look at the statistics, more
Mm,
girls are studying now. Um, so that I think is a good thing. The age of marriage has been pushed back a little bit. That is
mm,
again is a very good thing. Um, these kind of and women are in Pakistan. It's really heartening and encouraging to see women taking part in almost all professions and all walks of life,
mm,
from being pilots, for example, working in corporate institutions to teaching medicine and so on. So it's really good to see that, and we need more and more of that. But of course, this has to be backed up by mass education, and it has to be backed by strong laws which
mm,
are not just in the books but they are implemented also. And it needs a lot of education. Only then things will improve further. But yeah, there are obviously progressive signs. And but my feeling is, given the size of the population Pakistan has, the kind of the population growth rate that Pakistan has, this is all driven by lack of education. And
mm,
until and unless we educate our masses
mm,
as the fundamental thing, many of these problems will not be controlled. I give you just one example. We have spent billions of dollars over the last 60 years or so in family planning, in trying to
mm,
slow down a growth rate.
mm,
It
mm,
has not made a shred of a difference. And the basic fundamental thing, if you look at that, if you talk to the experts,
mm,
is the lack of education.
mm. Yeah.
And so, whether it's implementing traffic laws
Mm,
or making people pay taxes or controlling the population, if you don't have that basic thing of education, and then the preference of male versus female
mm,
in terms of everything, education, leisure activities, food, clothing, everything,
yeah.
further adds another layer
Mm,
to women disempowerment.
yeah. So a lot of, I mean, the foundation that you're talking about needs to be led by the government, needs to be led by the politicians. Can uh, can professionals like us in this community, what do you feel that we can do?
So, I mean, the two really important things. One is to produce evidence. So anything with that we do must have good scientific evidence. So as professionals, we must keep producing evidence through good scientific research. And we must train ourselves, whether you're counselors, whether you're
Mm,
therapists, whether you're health professionals
mm,
in any field, we must learn the basics of research methodology.
mm,
It's extremely important. Unless we produce evidence, unless we publish and have evidence, we cannot convince anyone. So that's number one. Number two is, we really must raise a voice. We must become advocates, mental health or health advocates, political advocates. We don't do that enough.
mm. Okay.
We don't organize ourselves enough, and to raise a collective voice and pressurize the people who have the power to bring about this change. We don't do that
Mm.
because
So,
one, we are very busy. Second, we feel threatened if we raise
mm,
a voice.
mm,
We are not good at organizing ourselves, and therefore the problem just gets compounded. But that is fundamental. That is extremely important that we do so. We don't do that.
mm. Okay. How is what is the research sort of progress in Pakistan?
It's definitely much better than it used to be.
Okay.
Uh, um, Institutions like AKU, like
Mm.
GIK, for example, IBA, and many others,
Mm.
uh, LUMS. I'm talking of not just health but many other areas. These institutions have really uplifted the research profile of Pakistan and produced some really good research. That is what we needed, and we still do. So that is much, much better than what it used to be, say, even 30 years ago. And we need to build on that.
Okay.
So now, with the accessibility of these tools that we have now of information technology, particularly young people who are very very good at these things, we are producing much better research. As far as mental health research is concerned, we
Mm.
still lag behind a lot,
Okay. Okay.
and the reason for that is we don't have good data.
Mm.
For example, if you asked me कि जी पाकिस्तान में कितनी खुदकशियां होती हैं हर
Mm.
साल,
Mm.
I can I can quote you WHO की
Mm.
estimates, वर्ल्ड हेल्थ
Mm.
ऑर्गेनाइजेशन की estimates, वो
Mm.
मॉडलिंग करते हैं।
Mm.
पाकिस्तान के अंदर कोई प्राइमरी डेटा कलेक्ट नहीं कर रहा है
Mm.
खुदकशी के ऊपर।
And another reason could be कि आप उसको एज अ सुसाइड आप उसको रिकॉर्ड भी करते हैं या नहीं?
एग्जैक्टली, सो पूरा एक प्रोसेस है ऊपर से नीचे तक कि
हम्म।
आप उसको डायग्नोज भी करते हैं कि नहीं कि सुसाइड
हम्म।
है,
हम्म।
या उसको बदल देते हैं किसी और
हम्म।
चीज में,
हम्म।
स्टिग्मा की वजह से या
या
किसी और वजह से।
या
तो वो भी एक इशू है।
हम्म।
उसमें पुलिस का कितना हाथ है, मेडिको लीगल ऑफिसर्स का कितना हाथ है।
हम्म।
फिर वो अगर कहते भी हैं आप सुसाइड, तो उसको रिकॉर्ड कैसे करते हैं, कहाँ करते हैं, और वो रिकॉर्ड जाता कहाँ पे है।
हम्म।
तो ये सारी, आई मीन, द डिफरेंट स्टेप्स टू द होल
या
थिंग, बट यू आर एब्सोल्युटली राइट।
हम्म। because a lot of people don't want to record it as a suicide.
या, एब्सोल्युटली।
Yeah. Yeah. Okay. So there is an improvement in research from what you are saying, but there is a gap in mental health research.
बिल्कुल।
Mm.
The other thing I, sorry, mental health research से
Mm.
के हवाले से is most of the research is what I call opportunistic research.
Okay.
रिसर्चर्स के लिए या जो एकेडमिक इंस्टीट्यूट में काम कर रहे हैं, रिसर्च इसलिए इम्पोर्टेंट एक होती है क्योंकि उनके प्रमोशन के लिए बड़ी जरूरी होती है।
Mm. Mm.
नंबर ऑफ पेपर्स दैट दे हैव पब्लिश।
Mm.
सो वो ये नहीं देखते हैं कि ये जो रिसर्च हम कर रहे हैं इसमें मुल्क का की कितनी
Mm.
जरूरियात है, इस रिसर्च से कितना फायदा होगा।
Mm.
लेकिन वो कर देते हैं क्योंकि पब्लिश करना उनके लिए बड़ा जरूरी है।
Yeah.
सो एक रिसर्च स्ट्रैटेजी मुल्क के लिए बड़ा जरूरी है, जहाँ पे वसाइल इतने कम हैं या महदूद हैं, कि हम टारगेटेड स्ट्रेटेजिक किस्म की रिसर्च करें। किस किस्म की हमें रिसर्च की जरूरत है। क्या
Mm.
हम जो लोग खुदकशी कोशिश करते हैं, बच जाते हैं, क्या हम उनके लिए सीबीडी के ट्रायल्स करें,
Mm.
कॉग्निटिव बिहेवियर थेरेपी या
Yeah.
डायलेक्टिकल बिहेवियर थेरेपी के ट्रायल्स करें, या जो फंडामेंटल चीजें हमें यही नहीं पता है कि कराची में कितने लोग, जिना
Mm.
अस्पताल और अब्बासी शहीद और सिविल और बाकी जितने अस्पताल हैं, उसमें कितने लोग हर साल जहर पी के आ जाते हैं और उनका क्या होता है। वी डोंट इवन नो दैट,
Yeah.
but we are going at something which is perhaps more relevant to evolved systems like the West, कि CBT का क्या रोल है
Mm.
secondary prevention में, या DBT
Mm.
का क्या है।
Mm. When you're
So
actually
that is
not,
what,
when you actually don't even, you're not even researching what the roots are. So
absolutely,
the your it kind of becomes more superficial because you're not
yeah,
looking at the root, the root of the cause.
बिल्कुल।
Yeah. Okay. Okay. Anything else, Dr. Murad, that you'd like to mm, speak about? Any message that you'd like to give?
Well, I mean, there are lots of lots of things I can speak about, but overall, things are better. There's no doubt. We have to keep fighting. We have to keep raising a voice. That is very, very important. We have to keep challenging the systems that are causing so much distress in our population.
Yeah.
We have to do that. We have to step out of our bubbles. We need to get our hands dirty. And we really need to look at the fundamentals, what is happening. And जो मैं हमेशा जब भी
Mm.
कोई पूछता है मुझसे, मैं कहता हूँ कि जब आप सोचें किसी चीज के बारे में, कोई प्रोग्राम के बारे में या कोई रिसर्च या कुछ,
Mm.
don't keep in mind the background you come from. We are middle
Mm.
class people. We
Mm.
are well off. We get 3 meals a day, live in good
Mm.
housing. Always think of your masi and the children and the
Mm.
driver and the चौकीदार.
Mm.
उसके साथ क्या हो रहा है, उसको
Mm.
जो काम कर रहा हूँ उससे उसको फायदा होगा या नहीं होगा.
Mm.
Or the destitute in Pakistan, of which there are millions, literally millions. So keep that focus going, and that I think gives you a sense of humility, which I think is extremely important for us to remain grounded. And जो मैं पॉलिटिकल विल की बात कर रहा था वो यही होती है ना कि भाई आप लोगों की मुश्किलात को आप कैसे दूर कर सकते हैं,
Mm.
which we don't do. So this is my message. No matter what
Yeah.
you do,
Mm.
whatever you're doing, make sure that you're doing everything that will ease the suffering of the masses.
Okay.
That is very important.
So it sounds like you must have seen a lot, traveled a lot in all of your research and seen what the masses have gone through.
I have more important than the quantity, I think, is the
Mm.
quality of the interaction.
Mm.
And um perhaps I don't know, naturally or developed, you have to have a listening ability,
Mm.
not hearing but listening. You need to listen and absorb and see what is happening. And that, I think, if you're able to do that, it'll go somewhere. It'll stay with you, and it'll help you to look at things, help you develop a lens. So listening is extremely important, and never ever be prescriptive, but to see what is happening with other people. Just be an observant,
Yeah. A witness.
a witness.
Yeah.
Absolutely,
Mm.
yeah,
So are you still involved in research?
absolutely,
Okay.
yeah.
All right. Okay.
Yeah. So I'm involved in clinical work,
Mm.
which I think is extremely important because you need to know what is happening on the ground. I need to get first-hand information. So listening to patients, what is bothering them,
Mm.
what are the things that they are grappling with is extremely important for me. And I try and see people from all strata of the society. That is very
Mm.
important for me. Second is that helps me then generate research ideas.
Mm.
What kind of research do I need to do? So जो मैंने आपसे बातें की हैं, women mental health
Mm.
की, these are all things that I've picked up from in my clinic.
In your clinic, yeah. Mm.
Listening to
Mm.
people, listening to women, listening to other people.
Mm. Mm.
That's where I've picked up. So, so research, the clinical work is very important. Research is very important because you generate new evidence for that. You come up with ideas, come up with findings that could be used in policy, that
Mm.
could be used in prevention. And third thing is teaching. How do you pass on this to the next generation of mental
Mm.
health professionals or health professionals? So all these three things are very important. And
Mm.
anyone in this field, I would definitely advocate researchers to do clinical work, clinical
Mm.
clinicians to do research, and
Mm.
then use both of these to teach.
Okay. Sounds like you love what you do.
पैशन के बगैर तो नहीं कर सकते आप कुछ भी.
हाँ, हाँ.
You cannot sustain a
Mm.
50 or 60-year career
Mm.
uh, without passion.
So
So that is very important.
did you find is the passion in being a doctor, or is the passion in being a researcher?
Both. So, doctor, yes, I don't think I could have done any other profession, followed any other profession. Even if I came back again, I would do the same thing.
Mm.
Maybe a little differently, but definitely because I really do not think, to me personally, um, there is, and I may be biased, is a
Mm.
better profession than being a healer. So that's number
Mm.
one. But number two is research is extremely important because it really helps you to question the what, the where, the how, the when and why. This is extremely important. We have to be curious. We have to be inquisitive. We have to keep finding. And if you look at the history of the world, people have done research. That's why we are here.
Mm.
So, if I can move this a little bit, tiny fraction during my lifetime, then that's good work done. So research is extremely important, yes, and being a physician is very important. And I would tell any young physician, as I do to all the
Mm.
medical students,
Mm.
is जो आप मेडिकल कॉलेज में आए हैं और जो आप प्रैक्टिस करेंगे वो तो साइंस है, वो तो करें आप, वो
Mm.
आपको मिल जाएगी और बहुत जरूरी है आपके लिए. लेकिन द आर्ट ऑफ मेडिसिन आपको किताबों में नहीं मिलेगी.
Mm.
आर्ट ऑफ मेडिसिन आपको क्लिनिक में मिलेगी, अपने सीनियर्स को ऑब्जर्व करके, गुड एंड बैड एग्जांपल्स बोथ, एंड टू लिसन टू द पेशेंट्स नो मैटर व्हाट यू डू. सो द आर्ट ऑफ मेडिसिन इज एज इम्पोर्टेंट. सो उसके लिए आपको हिस्ट्री ऑफ मेडिसिन पढ़ना बड़ा जरूरी है. व्हाट इज द प्रोफेशन अबाउट,
Mm.
why is it so special, why is it held in such high esteem.
Okay.
That is very,
Yeah.
very important for anyone.
So I mean, I'd like to end this by quoting some of your words, like being curious, healing, witnessing, listening. Um, how does that sound?
Yeah, absolutely. I mean, that is what makes us human beings. Like I said, it's a shared humanity. We've got to really look at it in that way. We are all interconnected.
Mm.
We may look different, skin
Mm.
colors may be different, we may talk differently, we may live in different places, but we are all interconnected. And
Yeah.
that is why, going back to that same quotation that I
Mm.
quoted earlier, any man's death diminishes me, is extremely important. We must be moved by any person's suffering, and we must celebrate any person's victory or joy.
Yeah.
We have to do that.
Okay. Thank you. Thank you.
You're
Thank you
welcome.
for your time.
You're welcome.
Dafis.
Love is.